Huntington's syndrome is a disorder that causes nerve cells in the brain to break down or degenerate over time. Huntington's disease affects a person's functional abilities in a variety of ways, frequently resulting in mobility, cognitive, and psychological problems. Symptoms of Huntington's disease can arise at any age, but they are most common in adults in their 30s and 40s. Huntington's disease is known as juvenile Huntington's disease if it develops before the age of 20. Huntington's disease manifests itself in a variety of ways early on, and the disease may proceed more quickly. With a wide range of indications and symptoms, Huntington's disease typically results in mobility, cognitive, and psychiatric issues. It substantially differs from person to person which symptoms manifest initially. Some symptoms appear to be more prevalent or have a bigger impact on functional capacity than others, although this can alter over time as the disease progresses. Disturbances in movement. Huntington's disease-related movement disorders can affect both voluntary and involuntary motions, resulting in symptoms like uncontrollable jerking or writhing motions, that is chorea. Issues with the muscles, such as stiffness or contracture, that is dystonia. Unusual or slow eye movements, gait, posture, and balance issues, and difficulty swallowing or speaking. The capacity to work, carry out everyday tasks, communicate, and maintain independence may be more significantly impacted by impairments in voluntary movements than by impairments in involuntary movements. The most common psychiatric disorder associated with Huntington's disease is depression. In the latter stage, eventually, the person will no longer be able to walk or talk and will need full nursing care. However, they will usually understand most of what they hear and be aware of their surroundings, as well as friends and family members. Frustration and depression can result from losing the capacity to perform tasks that were once simple. Weight loss can exacerbate symptoms and impair immunity, leaving patients more prone to infections and other consequences. Huntington's disease is rarely lethal in and of itself, but it can cause choking, pneumonia, or other infections that can be fatal. Now let's have a look at diagnosis of Huntington disease. The doctor will examine the patient and inquire about their family and medical history, as well as any symptoms, such as recent emotional changes, in order to diagnose Huntington's disease. They will recommend someone to a neurologist if they suspect they have Huntington's disease. Imaging examinations like a CT or MRI scan are occasionally advised by doctors. These can reveal structural alterations in the brain and support the exclusion of other illnesses. Genetic testing can also aid in the confirmation of a diagnosis. The Food and Drug Administration has given the go-ahead for 2 drugs to treat the symptoms of Huntington's disease. Tetrabenazine is used to treat Huntington's disease chorea, jerky, involuntary motions. Depression and suicidal thoughts or behavior are among the side effects. Involuntary movements, particularly those that could happen in the face and tongue, are also treated by deutetrabenazine or Austedo. If a person has depression or mood problems while taking these medications, they should see a doctor right away. Neither medicine is appropriate for anyone who has been diagnosed with depression, especially if they have suicidal thoughts. To ensure there are no additional medical conditions for which a patient needs to avoid these medications, they should consult their doctor. Clinical trials for a number of additional medications that might help people with Huntington's disease are currently being conducted.